The bullet didn't ask permission. It punched through fabric, skin, and muscle in a fraction of a second, and now you're staring at a hole that wasn't there 5 minutes ago. Maybe it's in your leg, maybe it's on your friend's shoulder, maybe it's somewhere worse, and you're trying very hard not to think about that. The hospital burned out 3 weeks ago. The clinic overrun. The nearest trauma surgeon is either dead or gone or 400 miles in the wrong direction. You've got a kitchen table, some questionable supplies from a ransacked pharmacy, and the kind of adrenaline that makes your hands shake like you've had 12 cups of coffee. This is not a drill. This is not a movie. There's no dramatic music, no handsome doctor rushing in at the last second. There's just you. A wound that's doing its level best to kill someone, and about 20 minutes before the shot turns this bad situation into a funeral. No worries. We're doing trauma surgery with duct tape, desperation, and whatever you can scavenge from the wreckage of the old world. Let's keep someone alive, understanding what you're dealing with. Before you touch anything, you need to understand something critical. Gunshot wounds aren't like the movies. They don't leave neat little holes. A bullet is a tiny missile of chaos. It tumbles, it fragments, it creates a shockwave through the soft tissue that turns a pencil-sized entry wound into a fist-sized cavern of destroyed meat. Your job right now isn't surgery. You're not going to fix this. You're going to stabilize it. You're buying time. Time for the body to do what it does best, which is desperately trying not to die. Two things kill people from gunshot wounds: bleeding out, which happens in minutes, and infection, which happens in days. Right now, we only care about the first one. The second one is a problem for your future, assuming there is a future for you. Step 1. Stop the red flood. Blood is leaving the body. This is bad. Your entire mission, your singular obsession for the next few minutes, is making that stop. Grab the cleanest cloth-like object within reach. A shirt, a towel, a torn curtain, a wadded-up jacket. It doesn't matter if it's sterile. Nothing is sterile anymore. It matters that it exists and that you can press it hard against that wound. Fold it thick. Make a pad. Now press. I mean really press. This isn't gentle first aid. This is you trying to hold someone's life inside their body with the force of your palms. Press like you're trying to push through them into the table beneath. Hold it there. Don't peek. Don't lift the cloth to check if it's working. Of course it's still bleeding. There's a hole. Every time you lift that pad, you're tearing away the cloth that's trying to form, and you're resetting the clock to 0. Just hold it. 2 minutes minimum. 5 is better. If the blood soaks through, do not remove the pad. Add another layer on top, then another. You're building a dam, layer by layer. The blood that soaked through is now part of the clotting structure. Removing it is the same as ripping out the foundation. Here's the science. Your blood is full of platelets, tiny cellular construction workers that rush to any breach and start sticking together like microscopic sandbags. Pressure helps them stack faster. Every second you maintain that pressure, the dam gets stronger. Every second you release it, the flood wins. Step 2. The tourniquet question. If the wound is on a limb and the bleeding is arterial, pressure alone won't cut it. You'll know it's arterial because the blood isn't just flowing, it's pulsing, bright red, spraying in rhythm with the heartbeat like a broken sprinkler head attached to a dying engine. This is when you need a tourniquet. Find something wide, a belt, a strip of torn denim, a dog leash, a ripped bedsheet, anything at least 2 inches wide. Do not use thin materials like shoelaces, wires, or cables. Those will slice through tissue like a garrote and guarantee you lose the limb, even if you survive. Wrap it around the limb a few inches above the wound. Not on the wound, not below it. Above, between the hole and the heart. Tie it in a simple knot. Now, find something rigid, a stick, a pin, a screwdriver, a wooden spoon. Lay it across the knot and tie another knot over it. This is your windlass. Start twisting. Tighter. Keep going. Tighter still. You twist until the bleeding stops, not slows, stops. This is going to hurt. If the person is conscious, they're going to scream. That's fine. Screaming means alive. Keep twisting. Once it's tight enough, secure the windlass so it can't unwind. Tie it down, tape it, use whatever you have. And write the time somewhere visible. Sharpie on the skin, blood on the forehead. Anything. A tourniquet left on too long kills the limb. You've got roughly 2 hours before the tissue below starts dying from lack of blood flow. After that, you're choosing between bleeding to death and amputation. Step 3. The entry and exit problem. Look for 2 holes. Entry wounds are usually smaller, neater, with edges that pucker inward. Exit wounds are larger, messier, with torn tissue pushing outward like something exploded from inside, because something did. If there's no exit wound, the bullet is still inside. This is actually not the disaster you might think. Bullets aren't inherently toxic. They don't poison you by existing. What matters is the bleeding and the infection risk. Leave the bullet alone. Digging around for it with unsterile tools in a non-surgical environment is a fantastic way to cause more damage than the bullet ever did. If there's an exit wound, congratulations, you have two problems instead of one. Both holes need attention. Both holes are bleeding. Prioritize whichever one is worse. Step 4. Packing the wound. Once the major bleeding is controlled, you need to pack the wound. This sounds medieval because it is, but it works. Find gauze if you have it. Clean cloth strips if you don't. Rip a t-shirt into ribbons. Whatever you have, it needs to be able to be pushed into the wound cavity. Start at the deepest part of the wound. Use your fingers or tweezers to gently but firmly push the material in. You're not just covering the surface, you're filling the entire cavity, layer by layer. Think of it like stuffing a small, horrifying turkey. The goal is internal pressure. You're creating a scaffold for clots to form on and applying pressure from the inside where your hands can't reach. Pack it firm but not crushing. You want resistance, not a blockage. Once the wound is packed, cover it with a larger dressing. Tape it down. Medical tape is ideal. Duct tape works, electrical tape works, Scotch tape is a joke. But if it's all you have, you layer it like your life depends on it, because it does. Step 5. Fighting the invisible enemy. The bleeding has stopped. The wound is packed. You've bought time. But there's a second killer waiting in the wings, and it's patient. Infection doesn't show up for hours or days. It creeps in quiet, and then explodes like a bomb in the bloodstream. If you have antibiotics, now is the time. Amoxicillin, doxycycline, ciprofloxacin, anything broad spectrum. Follow the dosage instructions. Take them all, even if you start feeling better. Stopping early is how you breed superbugs that laugh at medicine. No antibiotics. Look in the kitchen. Real honey, not the processed corn syrup stuff, has genuine antimicrobial properties. Smear it on the wound before dressing. It sounds like something out of the Middle Ages, because it is, but it's also backed by actual science. Garlic is another option. Crush it, mix with a little oil, and apply to the gauze. You'll smell like an Italian restaurant, but allicin, the compound in garlic, has legitimate antibacterial effects. It's not penicillin, but it's better than nothing. And nothing is what you've got. Step 6. The shock clock. Shock kills more people than the wounds that cause it. Your body is a trauma queen, and when it experiences trauma, it sometimes decides to just shut everything down in a cascading failure of systems. Watch for the signs. Pale, clammy skin, rapid, weak pulse, shallow, fast breathing, confusion, cold sweats, lips turning blue. And here's the terrifying part. If you're checking yourself for confusion and you realize you're confused, you might not realize you're confused. That's how shock works. If shock is setting in, lie down immediately. Elevate the legs above the heart if possible. This forces blood back to the vital organs. Get warm. Blankets, jackets, body heat from another person, anything. Your body is redirecting blood away from your extremities to protect your core. Help it. Sip water slowly. Don't chug. Your stomach isn't processing anything efficiently right now. Small sips. Stay conscious. Keep talking. Have someone talk to you. Silence lets you slip away. Step 7. The long watch. The immediate crisis is over. Now comes the hard part. Waiting, watching, hoping you didn't miss something. Check the wound every few hours. Look for spreading redness. Feel for heat. Smell for rot. If the area around the wound starts expanding its redness like a growing bullseye, that's infection spreading. If it starts to smell sweet or rotten, that's tissue dying. Both are very bad signs. Keep the patient hydrated, keep them warm, keep them eating if they can stomach it. The body needs fuel to repair itself, and repair is the only thing that's going to close that hole for good. Change the dressing daily if you can. Each time, look for improvement. Less drainage, less swelling, edges that are starting to close rather than gape. These are good signs. These mean the body is winning. Why this works? Here's the beautiful, brutal truth about the human body. It wants to live. Every system, every cell, every chemical process is geared toward survival. Your blood clots on its own. Your immune system hunts invaders without being asked. Your tissue regenerates, slowly, painfully, but relentlessly. Everything you just did was support work. You stopped the bleeding so the clotting could catch up. You packed the wound so the platelets had something to build on. You fought infection so the immune system wasn't overwhelmed. You managed shock so the organs kept functioning. You're not the surgeon. You're the construction crew holding the building up while the real workers do their job inside. And now look at you. There's blood on your hands, literal blood, but the person in front of you is still breathing. The wound is packed, the bleeding has stopped, the color is starting to come back to their face. No hospital, no surgeon, no sterile operating room with beeping machines and competent staff. Just you, some scraps, and the stubborn refusal to let death win this round. The next few days will tell the real story. Fever means infection. Improvement means survival. But right now, in this moment, you did something most people never could. You looked at a gunshot wound, at chaos and blood and screaming panic, and you didn't freeze. You acted. That's the difference between the living and the dead in this new world. Not luck, not resources. Action. Now clean yourself up, drink some water, eat something, because the work isn't done. It's never done. But for right now, for this one moment, you won. And winning, out here, is everything.